Licensed assisted living care facilities in Tennessee are being invited to add bounce back beds to their assisted living services. Bounce Back Beds is a resiliency-focused program developed by therapists, nurses, community life and mental health professionals. Working with your team members and designated residents, their families, and their primary care providers, residents receive guidance in reclaiming the ability to live independently, either in independent senior living or in their own homes. The program is being offered to you at no cost through a grant provided by the State of Tennessee Healthcare Resiliency Project. By choosing to add bounce back beds in your assisted living, you will create a new product line, helping seniors regain independence to enable them to return home or to senior independent living. Reach a segment of the senior population that cannot afford assisted living long term, but can afford a short-term stay. Grow your census by attracting new residents and preventing loss of current residents to nursing homes or return to hospital admissions. Energize your staff by helping them develop new skills and a renewed sense of purpose. Position your organization in the community as innovators who are committed to the best possible results for the seniors you serve. Bounce Back Beds are the next step in the evolution of senior care in America. In the 1700s, almshouses were developed to provide a safe place to live for those who were old and poor. In the 1800s, apartment houses known as homes for the aged took the place of almshouses. 30 to 50 seniors were housed together in large apartment homes, where they handled most of their own daily needs, but often shared meals. From 1935 through the 1950s, federal money became plentiful to build hospitals and connect nursing homes. These nursing homes became the best option, especially for seniors who were poor. Often 4 or 5 seniors were housed together in one room where they were not allowed to have any of their own belongings. Though most were not sick, they had to assume the role of a patient, giving up autonomy and contributing to the stereotype that all older people are sick and infirm. The recession of the 1980s resulted in real estate investors seeking to put their money someplace other than in single-family homes or apartment houses. They came up with the idea of building apartments for seniors, adding hospitality services, and offering enough care assistance to attract seniors who could afford it away from the disliked nursing homes. Thus, the first assisted living programs that we know today were created. About 15 years later, specialized memory care was added and is now the fastest growing segment of the industry. The development of bounce back beds in assisted living is the next step, growing the potential of both the assisted living industry and the potential of the seniors being served. The Bounce Back Beds project assists you in developing a unique plan for residents in the program that utilizes therapeutic, medical, psycho-spiritual principles paired with common sense and creativity to help residents reclaim adequate functioning to be able to live again in an independent setting. The project uses principles that were successfully used in the resiliency program at Summit View in Chattanooga for over 15 years. Your staff will be taught the basic skills for developing a bounce back care plan. They will be mentored by experienced professionals who are part of the Bounce Back project team. They will also have access to easy-to-use support material developed by the professionals who are part of SACFR, the Southeast Advocacy Center that promotes elder resiliency. If your program is interested in becoming a Bounce Back Bed site, then you must agree to carry out the Bounce Back Beds program over the next 18 to 24 months, providing simple monthly reports on your progress. Designate 2 people, with at least one being a nurse, to coordinate the project as part of their job duties, and to have time to train the rest of your staff in Bounce Back principles once they have finished their own training. Work closely with the Bounce Back project personnel to grow knowledge, skills, and program efficacy, utilizing help from on-site consultations and video conference meetings. Participate in a special on-site training program that is available for all program coordinators. The Bounce Back Beds program provides an opportunity for you to become part of the leading edge in the next evolution of assisted living as we seek to meet the needs of growing numbers of seniors and many in the middle market. Not only will you grow your program, your census, and your staff skills, you'll grow the resiliency potential of the seniors you serve.